we know that there are factors called social determinants of health that will impact whether or not patients will receive the same care as somebody else with a similar condition. And those might include where you're living, your living situation, access to education, access to food, and then, your finances, So anyhow, I just recently, I'm editor-in-chief of a Journal of the Advanced Practitioner in Oncology, which is a peer-reviewed journal for advanced practitioners who take care of patients with all types of cancer. And my recent editorial focused on that topic. I think the goal for me to discuss financial toxicity was just, again, in terms of raising awareness for providers. So many of us know that there are some, acceptable side effects or toxicities in terms of finances with care. So for example, if you get a copay for an antibiotic, we know it's going to cost $4 or $5. But for some patients, $4 or $5 might be a lot. And they'll accept that as the cost of care. There are numerous programs and copay assistance foundations available through American Cancer Society, Leukemia Lymphoma Society, and other grants that are available for patients. And so I like to say, just ask, just ask the patient, are you having trouble making ends meet or providing a copay for my visit? So for example, when people come to see me as a nurse practitioner, there's a copay that's often associated not only to see me, but to get their treatment. So just asking patients, how are you doing financially? And give them permission to not feel bad about it. I think a lot of people are hesitant or think, oh, well, I'm going to save money for somebody else that might need it worse. But giving them permission to speak up and say it's okay if you really need help or you can't meet this copay. Just let us know and we'll help you provide for grant funding. I just had a patient in clinic the other day that was paying $200 a month for their pills. And they thought that that was the expected copay, and they didn't realize that there might be copayment assistance for that. We were able to fill out money for grant funding for that patient, and then they were able to successfully buy food and pay for parking and going back and forth to visits. And it just made them feel so much better emotionally that they, you can afford it now or next month, but what if it's like a year down the road? Are you still going to be able to afford this if your situation changes? Shared decision making is that process where the patient sits with their their caregiver or their spouse or whoever. But the patient is on one end, and then the provider healthcare team are on the other end, and then we mutually share information. And nurses are critical to the shared decision-making process because sometimes they don't want to speak up to the doctor, nurse practitioner, or PA, but they'll confide in that infusion nurse or the nurse that is their nurse care coordinator. And so nurses are such a valuable part of that shared decision-making process. And sometimes the financial concerns or the side effects that the patients are experiencing, it'll be to that nurse that they'll go to before they go to their physician or the other providers. They'll latch onto somebody oftentimes, and they're such a valuable member of the healthcare team. And so I want to underscore how important nurses are to the health and well-being of our patients.